Hi, this is Letitia saying I am the psychiatric nurse practitioner. Currently, I'm going to present to you effects of COVID-19 vaccine on mortality rate in Colorado. Introduction. The benefits of COVID-19 vaccination outweigh any potential risks in older, more susceptible population, and our data did not support any policy that would forbid older people from obtaining the vaccine. However, it is important to monitor COVID-19 vaccination. The COVID-19 vaccine is safe for younger groups. The majority of deaths were among the elderly, frail ones, which are over 85 years old, in long-term care facilities, and mostly with medical conditions such as dementia, hypertension, heart failure, COPD, diabetes, anemia, falls, and other medical diagnoses like cancer. Um, CDC shows that in the start of 2021, when vaccination was readily available, more than 1 in 4 COVID-related deaths in the state had taken place. The majority of deaths were caused by residents who were not immunized. Over 2,900 of those fatalities happened since the start of July, according to CDC, and the majority of people who died in the subsequent month were unvaccinated and slightly younger than those who died in the earlier waves. After the vaccine was available, the state abolished practically all pandemic health regulations. Among all the states and District of Columbia, Colorado has the 10th lowest mortality rate and 17th lowest case rate. The state is also ranked the 19% of eligible population that has received at least one dose of immunization and is ranked higher for vaccination rates just among the adults. The state of Colorado is ranked 20th in terms of average number of COVID examination per individual. Also, a new study of Brown University found that immunization could have been prevented more than the third of Colorado, more than 13,200 COVID-19 deaths. Even though this rate is among the better ones in the country, it is nevertheless shows that the effect that vaccine access and reluctance have been on pandemic stages. The analysis uses data that is current from April of 20th to examine the death that took place after January 1st. And the amount of preventable death or mortalities also became more obvious given that the vaccine only been available through the spring of 2021. Since the COVID-19 vaccine release, Colorado data has shown a clear correlation between the higher COVID immunization and the lower rates of severity in COVID-related death. And in March, when the state vaccine dashboard data was most recently updated, the death rate for those who had not gotten vaccinated were more than 7 times than it was for those who have been vaccinated. With 74.4% of eligible residents vaccinated, the state has 16th best immunization rate in the United States. Not just Colorado, but other states also have a higher preventable mortalities. While the Delta wave, which began in July and ended only with arrival of Omicron in December, has caused a surge in death in Colorado. Colorado has at least 200 deaths every week, 13 week and 15 week between early February and early November. Some of the factors that probably related to access was access problems, like people who live far away from the cities. Through the epidemic The Hispanic population have perished disproportionately high rate. This is because of um, comorbidities or medical diagnosis. However, not a single week has gone over 200 since that time. In actuality, since mid of March, the state has consistently reported less than 50 weekly fatalities. And those are my reference. Thank you very much. Bye.